Hi, everybody. Welcome to today's webinar. My name is Leila Moomin, and I am the Community Engagement Coordinator for the Canadian Cancer Survivor Network. Thank you for attending today's webinar entitled Advocacy Overview, Shaping the Advocacy Agenda. CCSN is pleased to welcome Ryan Clarke, President and Founder of Advocacy Solutions. He helps advocates synthesize advocacy campaigns, amplify campaign messaging, and engage and influence key decision makers through the development and implementation of impactful advocacy strategies. Since founding the practice in 2003, Ryan has spoken about advocacy across Canada and internationally, teaching and training thousands of people on how to make their voices heard. In this webinar, Ryan will introduce you to the foundational components of advocacy and take you through the step-by-step process of developing an effective advocacy strategy. He will also help us gain an understanding of how shaping the advocacy agenda is evolving in the context of COVID-19. At the end of the presentation, Ryan will answer your questions. However, at any time during the webinar, please feel free to type questions into the window at the bottom right of your screens. For those of you who have not attended an earlier webinar, the Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you would like to learn more about CCSN, please visit our website at www.survivornet.ca. This webinar is being recorded and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided in your registration. Now, I will turn things over to our presenter. Welcome, Ryan.
Thanks, Leila, and welcome everybody. It's good to be here with you. So this is the agenda for our chat today, the welcome and introductions we've just done, the webinar outcomes Leila outlined, but again, I'll just put them up on the screen quickly. Then we'll get into the content. What is advocacy? Why is it important? The fundamentals of good advocacy. We'll talk a little bit about telling your personal story, building and sustaining relationships, and then take you through a 5-step process for developing an effective advocacy plan. So again, these are our webinar outcomes. I won't read them. As I said, Leila went through them. So let's just move on to the beginning of the content. So I always like to start at the very beginning, which is with the question, what is advocacy? Well, it's verbal support or argument for a cause or a policy. That's a dictionary definition that I'm not terribly fond of. So instead, I describe it as telling your story to someone, and that someone could be somebody in government, it could be your physician, a hospital administrator, an employer, a school principal, or a teacher, it could be anybody, through various means with the express purpose of compelling them to do, or in some cases not to do something. In advocacy, this person that you advocate to is known as the decision maker. She or he will be the target of your advocacy efforts. Advocacy is a process. That's a first important point I want to make, that normally takes time to realize tangible results. It's not activism, it's not radicalism, it's grounded in sound, reasonable, rational thought or argument. There is no one way to do it. It's very personal to your own style or comfort level, and it's your choice how much you choose to do in a given circumstance. And finally, and perhaps most importantly, it's about empowerment. Advocacy is about exerting some form of control and initiating some form of action around an issue that matters to you. So why is advocacy important? Well, if you remember nothing else, you simply need to remember this. The squeaky wheel gets the grease. That's the way advocacy works, and certainly in the context of government or politics or any institutional or bureaucratic setting you may find yourself, the simple fact of the matter is that the squeaky wheel gets the grease. It's also important because if I work in government and an issue comes across my desk that affects you or your organization, and I don't know who you are, then in essence, your issues are never going to be heard because you're not at the top of anybody's radar. You're not on anybody's radar at all. It's also important because governments will do what they want, or they'll do nothing at all unless people intervene or insert themselves into the process. So we always tell people the choice to engage is really very simple. Do something and something may change. Do nothing and nothing will ever change in the context of your issues. And why is patient advocacy important in particular? Well, because patients, and by extension caregivers and those who are their loved ones, vote. They're voters, and voters matter to political parties and to people in power. People actually make decisions about who to elect, particularly at the provincial level, based on healthcare concerns. Healthcare is one of the top issues consistently on people's minds when they go to vote, certainly in provincial elections. The demographic that has the highest voter turnout, seniors, are one of the most concerned about healthcare issue. There's a reason why political parties seek to target seniors and speak to seniors and build policies for seniors around election time, and that's because seniors vote in a way and in numbers that many other segments or age ranges in society don't tend to vote. And of course, healthcare is consistently one of the most important issues to senior citizens. And finally, Canada has a rich history of people who've stood up and made a difference in health policy in the context of healthcare, and that's why, as patients and caregivers, and that's why it's important as well. For people new to the world of advocacy, it's often personal need that will compel one to take action. You're not looking to change the world, you just want to help yourself or a loved one. But it's out of this personal need that some people start to realize that they have an opportunity to bring about larger public policy change by advocating for broadly based issues. And we describe this as having graduated. You graduate from what we call personal advocacy, being concerned only about yourself and your own circumstances, to issue-based advocacy, essentially recognizing that if you're having a problem or if your family's having a problem, then others must be having a problem. And so why don't we try to solve the larger problem on behalf of everybody? And people who think like this, and most people don't, which is fine, but people who think beyond themselves in this context can not only change health policy, we've seen them make health policy. Where there was nothing, there is now something, because one people or a very small group of people decided to graduate from seeing the world beyond just their own immediate and personal needs. The essence of good advocacy, this is the foundation. If any one of these elements is missing, you're going to have a difficult time starting to engage in advocacy, let alone get better at it. But let's start with an overview of the two really primary pillars of effective advocacy. And they are personal stories and relationships with decision makers. And let's begin with the first pillar, which are personal stories. So in a face-to-face meeting or in written communication with the decision maker, your personal story makes your issue come to life. And obviously we're not doing face-to-face meetings at the moment, but this still remains the case. It makes your issue real for the decision maker and provides a point of connection between the two of you. If properly developed and delivered, both properly developed and delivered, your personal story should fuel the logic of your one ask. We'll talk about your ask a little further on. And also the other thing that's important to remember, and it's listed there under your personal story, is it should be emotional. It should have emotion built into it. It is not the recalling of a series of facts. It is a recalling of a series of events, your life, but it also needs to be infused with the emotion that goes along with your journey and your life journey. But emotional doesn't mean sad. And I think a lot of people sometimes make that mistake. They think that, well, if it's something that was sad, or if it's something that was unfortunate, or if there was a misfortune, that's when I'll describe my emotion. And that's not the case. You need to describe all of your emotions: happy, sad, good, bad, absolutely everything. Because when it's imbued with a full range of emotions, that's what will help to motivate and guide the decision maker to what it is that you need them to do for you. So in terms of how to tell your personal story, as I mentioned, your ability to tell your personal story is the key to your success, particularly when advocating in person. And while we don't have the time in this presentation to answer all of the questions on this slide, let me review some of the more critical elements related to personal stories. So when you decide to tell your personal story, again, whether it's in writing or whether it's in person or virtually now, you really have two choices. You can either tell a summary of your entire story as it pertains to the issue at hand, or you could tell a portion of your story that focuses on one or two aspects of the issue at hand. I'm not sure how many of you on this webinar have ever written out your personal stories, but you really need to do so if you're going to be an effective advocate. In fact, it is essential. It's essential because we all forget things. It's essential as well because it's an ongoing story that you'll always be adding to, and you're going to need to create versions of your story, as I noted above, these two choices that I mentioned. It's also essential because when you are delivering your personal story, and this goes even in the virtual context, you're allowed to read it. I tell people, remember, it's not a test. Nobody's grading you, nobody's passing judgment on you on how well you deliver your personal story without having any notes in front of you. On the contrary, you don't have to be perfect at communicating your personal story for it to be effective. In fact, sometimes reading it can be the most impactful way to deliver your personal story. So don't be afraid to read it. You're not compelled to read it, but I typically tell people, if you've put in the time and effort to build a really solid, 2 to 3 minute of your 2 to 3 minute version, of your personal story, then why wouldn't you read it? Why wouldn't you make sure that everything that you've built is included? So there are some essential elements to your personal story. I'll just review quickly, 4 of them in particular. And each personal story should have these 4 elements for the purposes of advocacy. The first 2 are pretty straightforward. You want to have some basic personal details and facts about your personal situation and some background information, if you will, about your circumstances. The key messages will be included in the issue section, that's section 3, as you see there, of your personal story. And this helps to explain the problem and the change that you need to be made, that you're requesting be made on your behalf. If you're advocating for a broader issue as opposed to one that only affects you or the person that you're caring for, then your personal story will support your key messages. However, if you're advocating only for yourself or a loved one on an individual level, then your personal story will contain your key messages. So there's a subtle difference there. Broadly based advocacy key messages, your personal story, support your key message, and individual advocacy, your personal story will contain your key messages. And at every point, you want to convey your feelings about the details or events you described, as well as suggestions or solutions to achieve the one ask, which must also be included. That's your action step number 4 that you see there. We've created something called the 5-minute story challenge, and we can't emphasize this enough. Your personal story needs to be focused. All of the details and descriptions need to illustrate your issue and lead to your one ask. Making sure that your story is always on topic and relevant can certainly be a challenge, even when you've got only a short period of time in which to tell it. So we suggest that people take what we call the 5-minute story challenge. If you can't convey your story effectively in 5 minutes, ask yourself these questions and make the changes needed to tighten it up. You should know that in our experience, almost no one gets their personal story down to the essential elements delivered in 5 minutes on the first or even the second try. This takes certainly time to learn, but if you keep trying, you absolutely will get there. Now, let's review the second pillar of effective advocacy: building and sustaining relationships with key decision makers. Remember that it often takes time to realize tangible results through advocacy. In fact, it almost always takes time. That's because in part, relationships are so important to the process, and it takes time to build good, solid relationships with people of influence. But if you cast the net widely enough, someone will know someone who knows the decision maker you need to get to, particularly when you're advocating to government. It's not 6 degrees of separation, but it's typically much less in Canada. We have a very small, relatively small patient population, population spread out, as everyone knows, over this vast country of ours. But from a political perspective, you are probably much closer to the decision makers that you realize because of the nature and the structure of our political system. And certainly in the smaller provinces, smaller population-wise provinces, it's very, very close. But it takes patience, being at the right tables with the right people, staying engaged, but more than anything else, not getting discouraged and giving up. It relates back to what I said a little bit earlier. You've got two choices: do something and something may change. Do nothing and nothing will change. So it can be very difficult. It can be very challenging, but you need to decide when you go into this that this is something that you want to do and you're not going to give up until you achieve your objective. And when you have no relationships, well, in addition to some of the suggestions you see on the slide, let me add that it's never too early to start building relationships with decision makers, ideally before you need their help, not when you need their help. And it's all about making that first connection and then using that connection as a stepping stone to further connections, leading all the way to building a relationship with that decision maker who has what you need. So we tell people, don't miss a chance to communicate and don't stop communicating. Constantly be communicating with people about your issue. But it's also here that I think it's important to acknowledge the impact of COVID-19 for the first time on the work that we do. The last bullet there you'll see on the slide says, go to events where you know influencers or decision makers will be in attendance, or make an appointment to meet at a place and time that is convenient. Obviously, we can't do those things anymore. And we'll expand a little bit further at the end of the presentation, or closer to the end of the presentation, when we talk about your advocacy tools, about some of the changes that we're making to adapt, particularly around the last bullet that you see there. Now that we've discussed the fundamentals of good advocacy, or the pillars or cornerstones as we call them, around how to tell your personal story and the importance of relationships, let's walk through the 5-step process that you, as an individual or a group of individuals or a collective group, can start to do right away to create an actual advocacy strategy that you can then implement in support of your issues. So this is very practical, what I'm about to go through with you now. We're finished with the theory of advocacy, and it doesn't require necessarily substantive or substantial resources. But it does require a few things that I feel compelled to certainly share with you from the outset. Number one, this takes time. It takes time to make change. Change doesn't happen overnight. Change is not one meeting with your MPP or MLA or MP, and all of a sudden everything's changed. It just doesn't work like that. Again, particularly in the context of advocating to government. And time is a challenge for many of us, or most of us, because we never seem to have enough of it. Secondly, it takes a commitment. A commitment is a conversation you have with yourself or amongst yourselves, where you say, look, we are committed to making this change. It gets back to what I said a moment ago. We will not stop until this change occurs. And finally, a willingness to start and stick with it. Starting is easy. We start things all the time. But again, as I mentioned a moment ago, it's the sticking with it. It's the not giving up. It's the day in and day out, when sometimes it feels like absolutely nobody is even paying attention to you, that you continue to keep going. Because the choice is you go home, you stop, you do nothing further, and therefore the change you need, or the thing you need, will not come to fruition. So step one, identifying your issues. So Step one assumes that you, as an individual or organization, are starting from scratch. You have nothing. Well, the first thing you need to do is to ask yourself a question: what are the problems, concerns, challenges that we face individually or as a group? What are we here for? What are our challenges? What's the problem? You want to try to articulate an answer to that question for as many issues as you can identify. You might say, we have a number of challenges, 1, 2, 5, 10, 50, whatever it is. And you want to try to answer that question, meaning what are they? So kind of put them down. Now, not all issues lend themselves to advocacy, and this is a very important point to remember. There are some issues that you may have that cannot necessarily be solved through advocacy. And that doesn't mean they're not issues. They're still issues, but they just can't be solved through advocacy. And so we suggest that people take this little sort of test, if you will. It's the last bullet there. And that is for each of the issues that you've identified, can the objective or the change that you're seeking around that issue be achieved through advocacy? That's the first part. The second part, can a target be identified? Can an actual individual who can make the change that you require be identified? A target is not government. Government's just a word. You need to find, or need to be able to find eventually, the person within the provincial government in which you live, for example, who has the ability to make the change that you require or to fulfill the ask that you have. It may be more than one person, it may be a series of people, but you have to try to find a tangible individual human being as your target before you can continue, or before you can even get started, I should say. Step two, we want to test and frame your issues, the ones that you've identified under step one. The key in this second step is to be able to narrow down complex issues so that they are manageable, or what we call consumable from an advocacy perspective. Then choose one to begin with. You can't have multiple campaigns with the same target because you will risk getting nothing. Let me just clarify that a little bit. You can't have 3 campaigns targeting the Ministry of Health in your province simultaneously. That's 2 asks too many. It's one ask per target. However, if you were in the mental health space, which tends to deal with oftentimes many different parts of government, you may have a campaign that targets the Ministry of Health, and you may have a campaign, for example, that targets the Ministry of Education or the Ministry of Housing or something like that. That's fine. You could have 2 campaigns, one aimed at education, one aimed at health. That's absolutely okay. You just can't have 2 campaigns targeting the same ministry. I realize it's still one government, but because of the way government is structured, because of the way government works, it is okay to have 2 simultaneous campaigns running in that particular case. Now, COVID-19 will not have an impact on how you operationalize the 2 steps I've just reviewed, step 1 and step 2. They still need to be done if you're starting from scratch. What COVID-19 may impact is which issue you choose to focus on and how you frame that issue. In other words, how you narrow it down. Or more succinctly, for the foreseeable future, consider choosing an issue, if possible, that can be framed in such a way that it helps alleviate or solve some of the challenges associated with the pandemic. It's very common for people who do advocacy to government and who do so at a very sophisticated level to be able to, in as many circumstances as possible, to frame or position their issue, whatever it may be, in the context of a current challenge facing the government. In other words, as simple as, if you do this over here, which is the thing you need, it will help you solve your problem, government's problem, over here. Now, that's not always possible, and it is challenging, but I introduced that concept to you because right now, as you all appreciate, the world and government's world is dominated by the pandemic. So if at all possible, positioning your issue within that context will be, not maybe, it will be beneficial to you. Politicians as a group tend to know a little bit about a number of different things, and that's because they're required to deal with many different issues every day. And so this requires you to simplify as much as possible the issues that you put before them. But that doesn't mean you're going to dumb it down. It means that you're going to convey the core elements in a compact manner. You want to convey the core elements of what they need to know about your issue in a compact manner. And we do this through something called key messages. And that's why key messages are such a critical component to this step process that I'm walking you through right now. Your 3 key messages should tell a self-contained story. That's different than your personal story, but what I mean is there should be some flow. You'll see that on the next slide. There should be some flow to these messages. They're not just 3 random sentences. They'll be unique to your issue and to your circumstances, and they may also evolve over time depending on what happens with your issue. So you want 3 key messages that explain the salient points of the issue in simple language. Each one should be 25 words or less. We talk about something called the 3 C's. Your 3 key messages should be, or excuse me, the 4 C's. Your 3 key messages should be clear, compelling, concise, and consistent. All of those words mean something slightly different, and all of those words should be kept in mind as you're developing these 3 key messages. And practice presenting them to someone who has no knowledge of your issue, because that's really the key to messages like this, to your key messages, is that you're supposed to be able to deliver them to someone who has little to no knowledge about the issue. And at the end of these 3 sentences, or at the end of these up to 75 words, they should have a sense as to what it is that you're trying to convey. In terms of COVID-19, like with the framing exercise, if your key messages can include content that helps address the pandemic, I would absolutely consider putting it in. But don't do it just for the sake of doing it. Such content would need to naturally align with what you're trying to convey. So again, let me emphasize, when I talk about trying to align with the pandemic, I'm not suggesting you try to fit a square peg in a round hole. I'm suggesting that if there is some, again, what I describe as natural alignment or logical alignment, you should absolutely take advantage of that. So here's a model for developing key messages. It's a model, it's not the model. There are several out there, but this is one that we certainly like to use when we're working with clients. And I've sort of alluded to some of this already in my discussion. So first step is the problem. What's the problem? And you can see there's some bullets, some sub-bullets there to help you kind of consider and frame that up, the problem, the challenge, the issue. The solution. The next key message should consider saying, you know, how do we solve the problem? What would it look like if we made this change and if things were better than they are today and all of that kind of stuff. And then the last key message is typically what we call either your call to action or your one ask, or more specifically, it's a call to action that contains your one ask. It's the what you're asking this person to do as a result of this messaging that you've delivered to them. So we encourage you to use this model if you think it's helpful in the context of developing any key messages you may be doing. Step 4. This is the objective or the whole goal of your advocacy strategy, and that's determining and delivering your one ask. We say one because you're going to ask for the one thing you need and not a list of what you want. Let me say that again. You're going to ask for the one thing that you need and not a list of what you want, especially when you're advocating to government. If you ask for everything, you will get nothing. You need to stay focused on that one thing you need, even though you may need more than one thing. So in other words, this is about making choices. You may have 5 things as an organization that you need. That's fine. What I'm telling you is you can't ask for all 5 of those things simultaneously. Talked about that a moment ago. You ask for one of the 5 things, and then you say, once we've resolved this, we'll be back because we have more. So this is a case where less is definitely more in the context of advocacy. Also, it's very important to remember that your ask needs to be tangible. It needs to be a thing. So this is not an ask. Government, we need your help. Well, help's not a thing. It's not tangible. You can't bring me a plate of help. You can't bring me a cup of support. So all of the words that politicians in particular make a living delivering, help, commitment, support, are what we call the enemies of advocacy, because they don't mean anything. They're just words. But when you ask a decision maker, for example, to write a letter on your behalf to the Minister of Health, delivering, say, your key messages, then that's an ask. It's tangible. It's tangible because you can see it, you can feel it. It's a letter. It's a piece of paper if you print it. So it needs to be tangible, and that's a really, really critical point, kind of thing. Now, we haven't had any of our asks impacted or altered by COVID-19 to date, and you probably won't either, but I can't preclude it from happening depending on the circumstances. And the reason is because your needs are your needs. Now, again, like with the key messages, you might choose one particular ask over another particular ask because it's timely with COVID, but your needs are your needs. Your asks are your asks, and they remain your asks regardless of whether there's a pandemic going on. And finally, your advocacy tools. Anything that you have or produce that may be used to communicate with people is a potential tool in advocacy. And so I'll give you an example of some of them in a moment. But in this context, and aligning with this idea that advocacy is a process, we talk about the tools in the context of the first thing you need to do if you're going to advocate to anybody about anything is you need to educate them about your issues. You do that by delivering your 3 key messages we just talked about. Secondly, you need to demonstrate why your issue is important. Now, this is where most people make a fundamental mistake. They talk to a decision maker about why their issue is important to them. Why we'll say a patient group, for example, why the patient group's issues are important to the patient group. Of course they are. You honestly don't need to spend a moment convincing a decision maker if you're there on behalf of a patient group that your issues are important to your members or your supporters. Of course they are. What you need to spend the majority of time doing is demonstrating why your issues and the issues that are important to your supporters should also be or are also important to that decision maker. You demonstrate why your issues are important to the decision maker, not to yourself. And then finally, your step 3, which is to advocate, and that's linked back to the ask that you have, kind of thing. So it's simply a different way of showing or demonstrating what I've just gone through with you today, but it is kind of these 1, 2, 3 steps. You can't skip a step. You can't do them out of order. It kind of has to evolve the way I've got it now. Regardless of the issue or the target, if you skip steps 1 and 2 and go straight to advocating, you won't be effective at advocacy because you won't have built the requisite groundwork leading up to your one ask. Some people want to just walk in and say, I need this, but there's no context for it. There's no positioning for it. There's no demonstrating why this should even matter to the person who you've said you need this to. You've got to lay all that groundwork before you can make your actual ask. So here's a list of some of the more common advocacy tools we typically use. Interestingly, many are not impacted by COVID-19 at all. In fact, in the case of e-advocacy and social media, we're seeing an even greater reliance on these virtual forms of engagement since the pandemic was declared. But let me highlight 2 significant changes just before I conclude, and it links to what I mentioned earlier. Number 1, obviously in-person meetings. They are completely out for the foreseeable future. And so meeting with somebody over Zoom is something that is obviously coming to the forefront right now. And we think that it can be very advantageous. The preparation for those meetings, I don't know, is really any different necessarily than it is if you're going to meet in person. Sometimes the meetings tend to be a little bit shorter because you can kind of get more done in a virtual setting than you can in an in-person setting in many circumstances. But the materials that you use, the preparation that you take, all of that should really remain largely the same in an in-person meeting. But certainly, if any of you have had a different experience than that, certainly feel free to share it. I will be the first one to say that there is no substitute for being face-to-face from somebody. I think for a lot of reasons that we all understand. But I think being on a Zoom call, for example, is under the circumstances, and it is what it is in terms of the necessity of doing it this way, under the circumstances is a pretty good substitute. You can still see people. You can still read a little bit of their body language. You can still hear the tone in their voice and that kind of thing. And so we have switched completely to doing virtual face-to-face meetings. The second one are advocacy days. We've shifted to building virtual advocacy days or events for organizations. So rather than going off to, for those of you who don't know what an advocacy day, it's basically where you go to, for example, a provincial legislature. A number of you might go to a provincial legislature. You'd have a series of meetings over the course of a morning, a day, an afternoon, whatever it may be, with a bunch of decision makers. A number of different interactions. Could be one-on-one meetings. It could be a group breakfast. There's all kinds of different ways to do advocacy days at provincial legislatures or on Parliament Hill. Again, not able to do them right now. So we found that a number of advantages to them over traditional in-person meetings. One advantage is accessibility. In many cases, it's very difficult for people to get to Edmonton or Victoria or Ottawa or whatever it may be. And so doing advocacy days virtually is much easier physically in terms of not having to be there in person. Financially, there is a huge advantage to doing these virtually because it tends to be much more expensive to do an in-person advocacy session. You have people's travel costs, and parking, and stuff like that. And certainly if you're bringing in a lot of people from across the country, they are big endeavors and they take a lot of resources to execute. Whereas if you're going to do a virtual advocacy session, and again, it could be same thing, it could be a series of Zoom calls, it could be all kinds of different things over a period of time, then that helps. And then the final thing I can think of, and there may be other advantages, but one of the other ones is that when you do an advocacy day, it tends to be over the course of a day, or it all tends to be contained in a day. Like I said, one day, a morning, an afternoon, whatever it may be. When we do the virtual advocacy days, though, we can do them over a period of time. So, for example, it might be a patient organization meeting with a whole bunch of MLAs in Alberta over the course of 4 days. That's great. That's fine. You can have a lot of meetings. Scheduling them is a bit easier because you've got some more flexibility. But when you announce that you're going to Edmonton on one day and you want to meet as many MLAs as you can on one day, and that particular day, one of the MLAs you want to meet with is out of town, well, that's it. You're not going to be able to meet with them, at least not in Edmonton at that time. So people also like the flexibility of it not being contained in a single calendar day, but rather it can be done over the course of a few concurrent days, which I know is appealing to a lot of organizations. Anyway, let me wrap up now and invite any questions that you may have. So in conclusion, let me draw your attention to the last bullet on this slide. Government wins when you give up, so never give up. It's very easy to say. It's very challenging to do in many circumstances. You may all know, or you may all recognize that or appreciate that it's very un-Canadian to advocate for change. As I'm sure many of you know, this is a country that was founded on the principles of peace, order, and good government. And when you examine what the words peace, order, and good government mean, it's not exactly a recipe for big change. And so the biggest challenge that we face in our work is really just getting people to understand or appreciate or embrace the fact that they are certainly entitled to do this work. You just have to believe that you that you can do it and get started. So we encourage every individual and organization to get out there and seek the change that we need. And I appreciate everybody coming on the webinar and listening today. Thank you.
Thank you so much, Ryan, for that presentation. So we have a few questions from some of our audience members. The first question is, for a patient group who has never advocated before, how do we find who the government decision maker is and how to approach them with our advocacy case?
Sure. So in terms of figuring out who the decision makers are, one of the slides I mentioned had a few tips in there, but one of the easiest things you can do is simply start with one of your elected officials. So if it is a healthcare issue, it is likely provincial, or certainly the delivery of healthcare, it's likely a provincial issue. And so what you could do as the leader of the group or as board members in an organization is you could reach out to your own provincial members of parliament, and using that kind of 5-step process that I outlined, just tell them that this is what you're doing, and that part of what you'd like their help with is figuring out who in government, who at the provincial level in that province or provinces could potentially help them, help you out, excuse me. And that person will become your target. It's a bit of it can be a bit of detective work, that's for sure, but that's certainly one way to do it. Another tip is to ask other patient organizations who you may have a relationship with, and perhaps they've already done some work in that province or in a particular area, and ask them. Say, here's our issue. We don't know who exactly in government we should talk to, but do you have any ideas and places that we might be able to start? And then in terms of the second part, kind of getting started, it's really that sort of 5-step process to building a plan. And the one thing I should say is, I know I've laid it out in these 5 steps and it looks rather onerous, but it really doesn't have to be. I mean, the essence of it is you need to pick an issue. You need to figure out what you're going to say about it. Those are your key messages. You need to figure out how you're going to say something about it. Those are your tools. And then you need to figure out what you're going to ask for and of whom. So when you boil it down, it's really not all that complicated, but it certainly takes some time. And if you've never done it before, it certainly is an exercise that you need to take your time to do it right. So there's a couple of tips in terms of if you aren't sure where to start or who to target.
Okay, thank you. Our next question is, do you find that people are more effective during a virtual meeting than face-to-face? I find that some advocacy cases fail due to nervous energy in presenting or public speaking, and with online, there is less nervous energy.
Yeah, I agree. I think that's very true. I think it depends on the individual. I think there's no doubt that for most people who haven't done a lot of advocacy or are doing it for the first time or don't feel comfortable doing it, that meeting in person is probably more nerve-wracking or intimidating. I would fully understand why that would be the case. And I think the good news is that if you're more comfortable doing it virtually, I think there's going to be an acceptance of that way to advocate for the foreseeable future. I'm not one who believes that in 6 months, if there's a vaccine or something, the world's going to go back to being completely like it was before. I think from an advocacy perspective, we have entered a very different paradigm in terms of the opportunities that advocacy will afford us. And I honestly believe that for the foreseeable future, if you are most comfortable and most effective at having virtual meetings, nobody is going to suggest, well, why don't you want to come and see me in person? There are a lot of benefits even for the person you're advocating to do it virtually as well, including, time and that kind of thing. So, and they can do it from anywhere as well, right? You no longer have to go to their constituency office or go to the provincial capital or whatever. They can take it from anywhere, and there's also greater flexibility in terms of the time. I know people who've been having Zoom calls with elected officials, not bureaucrats, but with elected officials on weekends and after hours. And that wasn't unheard of in person, but not very typical in person. It's certainly happening now. So yeah, I think I view it as an opportunity. And if it makes people more comfortable, I think that's terrific.
Okay, thanks. Our next question is, what challenges and barriers do you think patient organizations face when it comes to planning and implementing advocacy efforts?
Challenges and barriers. Well, I've outlined a few of them. I think that time is one challenge for everybody. I think getting started is a challenge, knowing how to start, where to start, and I've tried to give some tips around that as well. Having just a general sort of depth and capacity to be able to do this work, learning and understanding how to do it. But again, you don't really need any more than what I've outlined to at least get started, and you're only going to get better through practicing. Resources are a challenge for a lot of organizations. They don't have a lot of money necessarily, and it takes nothing that I've outlined here costs money per se, but there are certainly elements of advocacy or components of advocacy, even amongst the things I've outlined, that would cost money. So for example, if you wanted to do a live advocacy day or something like that, that obviously costs money, as I've outlined there. Having enough people who are engaged in a process. A lot of smaller patient organizations, it's one person or maybe two people. And that's really tough to sustain, in part because if you're in healthcare, they're often patients or caregivers, and people don't, people at various times are in more or less of a position to be able to do this advocacy work. It's not uncommon for people to be able to take some time off to care for themselves and have to step away from this advocacy work. And that's related as well to the capacity issue. But there's no question that the biggest doubt of all, the biggest challenge of all is just sticking with it. It's not easy. It's a real challenge to do this day in and day out, to just keep going and keep going and keep going. So keeping your supporters engaged is probably the biggest challenge that we find in advocacy. And so there are a number of techniques. It kind of gets into the next level of advocacy training that we do, but there are a number of techniques to keep people engaged throughout a campaign, in the midst of an election, for example, and that can be a real challenge as well. So.
Okay, our next question. So you mentioned earlier that you must go in with one ask, but if you have other substantiated requests, should you leave those with the government official so they know what you'll be coming back to advocate for?
You could. There's nothing wrong with that. The technique that I like to use is something along the lines of, I like, so just hypothetically or visually, you would say to a decision maker, you'd hand them a piece of paper and say, on this piece of paper are the 5 things that we need. Now, the first one that's highlighted, that's the one I want to talk to you about today. In fact, we're not even going to talk about the other 4, but I wanted you to see this because I wanted you to see that we have these 5 critical things that we're working towards. Now, I think we can solve issue number 1. I'd like to work with you to solve issue number 1 and the one ask that we have, but understand we'll be back to talk about the other 4. So in answer to your question, that technique, which I've just outlined, is one where you tell them everything, but you get them to focus on the first one. That's fine. I would say in most circumstances, that's probably an okay technique. There are some circumstances, however, where I think you wouldn't want to necessarily reveal all of your asks, and you would want to just focus on the one. And one obvious circumstance would be if the one issue that you're focused on initially is quite complex in nature. If it's a long-term issue, it's going to take some time to resolve. It's not simple. Then I would suggest that you might just want to go with the one ask. And you can always say we have other issues and we'll be back, but don't necessarily talk about what they are and just focus on that one so that there's no temptation for the decision maker to say, well, I don't want to talk about that one. I want to talk about number 3. If you don't give them a list of 5, they can't do that. If you give them a list of 1, they can only talk about the 1. So that's for consideration.
Okay, our next question is, how do we best support and build community cohesion to optimize quality-based programs?
I'm not sure what we mean by quality-based programs. If it's in support of the community, again, or of the community that you're representing and that kind of thing. From an advocacy perspective, and I hope this answers the question, and I apologize if it doesn't, but really the critical piece is to engage your community and to make your community feel like they are contributing to any advocacy effort that you may be undertaking, or for that matter, any programs you may be developing or materials that you may be producing and that kind of thing. So in that regard, we're very strong proponents of surveys and roundtable discussions and webinars and anything that you can use to engage your community, to float ideas, float initiatives, and that kind of thing, and get their feedback. Because one of the things you want to be able to do when you're advocating to government is to be able to say that you are truly representing the interests or the will of the people that you represent, if you're a patient organization. And a survey, as an example, is a wonderful way to do that. So I think that's a couple of ideas. But again, I hope I've answered the question in the context of advocacy.
Our next question is, can you differentiate advocacy from lobbying or public relations? Are these separate ideas or should they be related?
It's a very common question that we give, and the short answer is that the difference between advocacy and lobbying, there really is no difference in the context of just those two words. Now, there are differences from a legal perspective in terms of, for example, the lobbyist registration requirements in certain provinces and at the federal level, and what it means to be a lobbyist. There's a definition of lobbying and that kind of thing. There is also under the Income Tax Act, the definition of what it means to lobby. The word advocacy does not appear anywhere in the Income Tax Act. But in essence, lobbying and advocating are the same thing, only in a pejorative meaning. Would you seek to differentiate those two terms? Some people feel that lobbying is more of a quid pro quo to it as opposed to advocacy, but they're essentially the same. Public relations is different. Public relations is where you seek to go out into the public domain, for example, or amongst a certain segment in the public domain, and to build up some measure of support for your advocacy work. Many advocacy campaigns, certainly most of the ones that we do, have a public relations component to them. Although I will caution you that when we say public relations, we almost never mean the public, the general public. You don't need everybody in Canada or everybody in Manitoba to know what your issue is in order to be able to affect change. you may need a certain number of people or segment of people in Canada or Manitoba to be engaged in your advocacy effort, but that is still public relations where you're going out into the public domain and seeking support for change you're trying to make. And ideally, you are trying to get them to join you in this advocacy effort through, again, various means and activities that they can undertake.
Great, so we're almost at the end of our time today, so thank you very much for answering those questions. And thank you everybody for attending our webinar today. CCSN would like to thank Ryan Clarke for his presentation on advocacy strategies. Ryan will be joining us again on October 8th to discuss self-advocacy, and on November 19th to provide some guidance on how to hold an effective meeting with your member of parliament or provincial representative. And I also wanted to let everybody know that next week we will be launching our 8-part empowerment series entitled CCSN's Remarkable Cancer Survivors Guide with Dr. Rob Rutledge on Wednesday, September 16th at 12 p.m. Eastern Time. This series covers a variety of psychosocial issues such as healing and recovery, integrating spirituality, and stress and resilience. You can find registration information for this series on our website under events. We will also be sending out registration information to our mailing list later this afternoon. We are very excited about the webinars we have scheduled this fall and hope that you will be able to join us. All of our previous webinars are accessible on demand through our website at www.survivornet.ca and on our YouTube channel. Thank you everyone for attending and have a great day.